Hello there. Thank you once again for sticking and staying with us here on Prime Morning. Time now for BTH. We go beyond the headlines. And today is the 25th day of April, 2022. And clearly, it is Global or World Malaria Day. And the impact is just to throw more light on malaria and get to harness us so that we get to understand what role we are playing, how far we have gone, and where we are going. This morning, I'm joined by Dr. Linda Eva Amwa, Senior Research Fellow at the Immunology Department of Noguchi Memorial Institute. And also, I've got Jeannie Boedi Boating. He is a rep from the Bliss GVS Ghana. Thank you for joining us, gentlemen. And Doc, good morning.
Good morning.
So I'll come to you first of all. How have we fared generally in the fight against malaria as a country?
I think as a country we've gone far. Over the past few years we have actually progressed, so we've made a lot of advances. We have cut down a bit on the number of deaths. We have cut down on those who actually have suspected malaria. We have increased those who are testing, and so we're actually doing quite well.
Okay, well, how did we do this?
So there are quite a number of interventions that we have in play. So the malaria control program has enhanced the number of interventions that they have put in place. So there's always distribution of the long-lasting insecticide-treated nets, which is distributed in districts. And once people have and they sleep in it, then it prevents us from getting bitten by the mosquito. Once we're not bitten by the mosquito, then the likelihood of getting malaria is far reduced. Then there is indoor residual spraying, where we have walls of houses sprayed so that when the mosquito that is resting stays on the wall, then they die. So that happens in certain places. Then we have, because mosquitoes, or the female Anopheles mosquitoes, lays its eggs in stagnant water. We have larviciding occurring across the country, where we spray larvicides on the water bodies, and that kills the mosquito larvae, which would have grown into the adult mosquito, which then would have come in to bite us. Then we have some control measures for pregnant women, where women who go for antenatal care are given medicine, which is SP, and that prevents them from actually getting malaria. It's a preventative measure. Then we have seasonal malaria chemo prevention. So with that, children in select schools in certain parts of the country are periodically given a full course of an anti-malarial so as to prevent them from getting malaria. So that also has helped a lot. Then there is prompt diagnosis and treatment. So now there's been a lot of campaigns to make sure that before anybody is given an anti-malarial drug, they're actually tested and they test positive. So with that case management, we've actually had a lot of success. And then now, for the past, I think 2-3 years, we've had the malaria vaccine implemented as a pilot.
Oh, great.
But then
I'd love
with
to
that,
talk about that.
Not too much though. But then, yes, and that also has saved quite a number of kids of infants from dying before the age of 5.
Okay, we'll try and take each one of these points and elaborate more. Okay. But let's go to GVS Ghana. So a little bit whispered to me that you've been doing some campaign and you've titled it Act for Africa. Is this true?
Yeah.
And so what is your concern about malaria?
So I think malaria still remains a burden to Africa. Ghana in a narrow sense of it. So I think as a pharma company, we have social responsibilities.
Okay.
We just don't, in quotes, just sell drugs and just make profits. At least we have to give back to the society whatever they've given back to us. So I think we started last year. We made donations to several hospitals. We continue this year. We've had talks with institutions, educate them on malaria and all that. So the Act for Africa campaign is mostly rechanneling our energy into helping Ghana reduce the malaria burden.
Okay. Okay. So the GVS company actually is a pharmaceutical company.
Yes.
Okay. And then this is one of your corporate social responsibilities.
Yes.
And so why did you particularly pick malaria? I mean, you said that it continues to be one of the world, but there's so many other world pandemics. Why did you choose malaria?
So we have anti-malarials. One of our largest portfolio has to do with anti-malarials. So I think it's just expedient that we look into that direction, channel activities using our anti-malarials to help the society.
Okay, so in all of your journey in this campaign, what has been the major challenge? What would you say is the major challenge where we're facing? I mean, Doc has said that we've made some great progress, but still it continues, despite it's treatable, but it's the reason why we're still sitting here talking about it if it wasn't a challenge. So what have you been picking up during this campaign? What have you been picking up?
I think one of the main things I've realized has to do with education. Yes, a lot of people know about malaria. They know it's caused by a mosquito and all that, but they don't really know the nitty-gritties, how you can prevent it, even the treatment. Really? Yes, there are people.
I would have thought that's very common.
No, there are people who might just take the anti-malarials for like 2 days, and then once they have the slightest, shall I call it wellness, they stop. But this can be detrimental to the treatment of malaria and even other anti-malarials. It can cause resistance and all that. So people don't really know a lot about the treatment, prevention and all that. Okay.
We'll come back and talk more about the campaign. Sure. Okay. So Doc, prior to COVID, right? If you search for data, you'd find out that as of 2020, the data would say that, so that I am correct, I saw that it says 5.9 million. People were diagnosed, and this is quite significant to some sort of reduction from the previous data being 6.7 million. This is up to 2020. But between 2020 and now, COVID was really loud and clear. Let's do some comparison as a doctor and living at the center. What have you been picking up? Is it that we took our eye off the ball and we focused so much on COVID, or we were still working? Because, I mean, you know that a person will start saying that I think I have malaria before we later find out that it's COVID. So what was the challenge then? Between this time, what has been happening?
Okay, so, well, I'll talk from the research point of view and probably not from a medic point of view.
Okay.
Let me just say from my personal point of view, at a point, if I have a headache and I go, the first question, everybody thinks you have COVID. So people actually even didn't go to the hospitals at all. And that was because they didn't want to be isolated because they had COVID. So during the COVID period, there were probably much fewer cases reported than actually was, because people feared that they would be classified as a COVID suspect and then treated as a COVID patient. So we did have some slight reduction in hospital attendance in people who actually went to seek treatment for malaria, because of the symptoms of malaria is so similar to the symptoms of COVID that there was quite a lot of mistaken, I wouldn't say diagnosis, but mistaken diagnosis in quotes.
Yeah. I agree.
Yes.
I understand. And I hope they understand too. Okay. Jeannie, so what goes into the hospitals or the places that you pick for the donation? Because malaria is not special. It doesn't say that because she's a doctor, it won't affect her. Yeah. So in all of the places that are in dire need, how do you do the order of priority? The selections. So
I think we look at the hospitals with a large OPD. So when I say OPD, it has to do with basically the number of malaria cases they get, the number of people they treat, and probably also look at the surrounding. Let me use an example, Kolebu Teaching Hospital.
Okay.
You realize the Kole area has lots of people who might not be rich, in quotes, and Kolebu sees a lot of malaria cases. So for a hospital like Kolebu, I think it was experience that we made donations to. There are other hospitals, so it was mainly the main criteria for choosing the hospitals we wanted to make donations. So you
donated to the hospital?
Yeah.
How would the person living in the area? Because if a person had malaria, don't go straight to Kolebu, would they, Dog?
I'm thinking
too.
So I think there are times the first point of call for some of these symptoms is the pharmacy.
Right.
Yes. And when they realize the treatments, the symptoms are still
then they go
to the hospital.
Okay. Doc, would you say that is expensive? I'm asking this because there's been global call for investment and innovation. Now, investment and innovation, which one is the most important one? I like to think that we're getting people who are investing, but we still have the challenge. So which one is it? Is it real investment, or is the innovation that we have to come up with in trying to fight this?
I don't think you can isolate one from the other.
Okay.
You need even to invest to become innovative. If you have a plan, you have an idea of how to make a very good diagnostic tool. Without somebody investing in that idea, it can't materialize. So we do need investment. Investment will help us actually even expand upon the current interventions that are ongoing. And it also help people who have some innovations to actually put their innovations out for it to actually materialize. So I don't think you can isolate one from the other. We do need a lot of investment in malaria. As you said, malaria is treatable. It is preventable. So you have investment in creating awareness. You also have investment in, if let's say somebody goes to a pharmacy and just goes to buy an over-the-counter anti-malaria, it's allowed. But now we've decided that you should be tested before you're treated. So if it happens that we do have a lot of investment, we can actually provide diagnostic test kits to the pharmacies at no cost to them because we have had donations or we have investment, and then they would make sure they test the person before they're treated. But then we also do have the problem where somebody may actually send someone to go buy, so he or she himself who's buying isn't the one who's sick. But I think there's a lot that we need money to do, and there's a lot of innovations that is needed. So we need both of them urgently.
Let's come back to data. And so in all of our collection of data, which sets of persons suffer the most? Children, pregnant women, or the elderly? Which sets of persons?
Okay, so you started very well. It is the infants under, children under 5 and then pregnant women. They are the ones who suffer the most because children under 5, their immune system isn't that well developed. And once you become pregnant, you also have become susceptible to a whole lot of different things. So these two categories are very susceptible to malaria. And most of our interventions are actually targeted to help them.
What's the worst that can happen to a pregnant woman if not treated? I mean, apart from death. Can the baby
the baby can be stillborn, the baby can be small for their size, the baby can have so many different effects. So it actually does harm the infant or the unborn child as well as the mother, the pregnant woman.
Okay, let's throw more light on the Act for Africa campaign that you're running. So you mentioned that you did, the first port of call was Kolebu, isn't it?
Kolebu was last year.
Oh, last year.
Yeah,
okay,
and last year we had like 4, Kolebu, Bridge, 37, and Police Hospital. That was last year. Okay. This year we went outside Accra, so we looked at Tema General, we looked at Kath Konfanochi.
Okay.
We looked at Ifya Kwanta. We went to Koforidua Regional Hospital as well. So we did quite a number of donations outside Accra this year.
Last year, COVID was quite, COVID was really busy. How did that affect your campaign?
I think though the media talks a lot about COVID, when you visit their facilities, they still get malaria cases. As she was saying, probably the first point of call will be the pharmacy. But if it's severe, if after 2-3 days the symptoms still persist, they'll definitely go back to the hospital. So the hospital still records malaria cases. Probably it might not be in larger amounts. Like as Ash was saying, because of COVID, people don't really go to the hospital and all that. But they were still recording malaria cases. And I think the drugs were still used.
Okay. So do you fund this project purely and entirely from GVS Ghana, or you're getting support from other stakeholders?
It was entirely from Blaze GVS.
I mean, it's none of my business, but I'm curious. Okay, Doc, so let's go back to the pointers and how we've been doing, how we've been faring. Let's go back to how we've been reducing it. I say the success story. I mean, from 2007, when World Health actually chose, I don't know why they particularly chose 25th of April, but from 2007 till now, would you say that the challenges are very peculiar to each country. Why is it a world challenge if what the challenges for Ghana would be definitely will be different from the other? Why the concern?
Well, because I think with Malaria Day, we're actually creating awareness on the fact that malaria is treatable, is preventable, and that we all have a role to play. So that message is universal. It's not really peculiar to one particular country. It's not that one particular country has to scale up on IRS or on nets or...
What is IRS?
Sorry, on the indoor residual spraying.
What is that? Okay, what you thought is about.
Yes, how to spray the walls of them. Yeah. Okay. So it just means that it's more of an educational campaign to let people know what is their own role, how they can actually help in reducing, and also to probably alert the funders that malaria is still a big problem, and so we still need some funds to help with the disease.
Okay, how have we fared with vaccines?
With vaccines, so right now there's only one vaccine for malaria, and it is only for infants right now. There is a whole lot of vaccine research. So this particular vaccine actually was in the lab for several years before it actually passed through and is now able to be used in humans. It takes a long time to develop a vaccine. It takes a lot of investment to develop a vaccine. And so with this one vaccine that we have, there were 3 countries that in 2019 piloted the study, and they've realized some very important facts, which is that it is safe.
Okay.
So once the vaccine is safe, then it means that whatever the case is, the benefits would outweigh the side effects because it's safe. It has saved at least between 40,000 to 80,000 infants in Ghana from dying, which is, I think, a very good thing. And what else should I say about the vaccine?
Okay, let's go to what the typical human reaction will be. Every vaccine has got its own, side effects. Did we discover anything from this, though you have said that it's safe?
I am not sure that they have been... well, so right now, I don't think the emphasis too much is on what the side effects are, but we haven't seen that many side effects. And also, it's been quite a short period of time. And even...
How long ago did we start?
We started in 2019.
Okay.
And 2019, so 2020, 2021, yeah, it's been only 3 years.
Okay.
But it's been proven to be very safe. All the reports that we have suggest that it is very safe. The only thing is that we have decided that instead of having 3 doses, we should have 4 doses so as to prolong its effectiveness. So it's been safe.
What do you mean when you say 3 doses? Is it the jabs that you're talking about?
Exactly.
So for an infant, they would have to come 3 times?
For right now, it is 3 times, but they have just recently added the 4th dose. So in Ghana, we are having this alongside the infant vaccination schedules. Okay. And I think the children come in at 6 months, 7 months, 9 months, and then at 24 months.
Okay.
So these are the timelines where infants are scheduled to have the malaria vaccine.
And then when they take it, that's at what age would you say that now, if you were a child, you'd have gone for it again? Like when you take it, it's forever or what?
It's not forever. But that is the most susceptible stages of the child having been infected by malaria. So if you're able to prolong the child through the early phases, then they have some level of protection. Then by the time the immune system matures, then they are able to survive without.
Okay. We'll still stay on the vaccine matter. I know you want us to talk a little bit about it, but we'll come back to stay. But Jimmy, for you as an institution, so this year you have been able to go to 4, right?
5.
5.
Yeah.
What's the picture like? What more are you hoping to do to help fight this challenge?
So far, as I said, we've had talks with institutions, we've had pharmacy campaigns. I think she even talked about the fact that now what they are doing with pharmacies is that when someone walks in, you need to test the person to make sure he or she has malaria before you give an anti-malarial. So we've also had educational campaigns with pharmacies, major pharmacies across the region to let them know the effects of they not making people test for malaria, the long-term effects, what will happen eventually. What was she talking about?
I mean, there was the bigger picture for you like this year, because malaria is never ending, though we are reducing it.
Oh, it will end.
Okay. I mean, it is being a challenge for us. The ending is becoming a stall problem. So, yeah. We want all hands on deck. We want more. All I'm trying to say is that we appreciate what you're doing, but how much more can you go further for us as a country?
So I think we are open to helping NGOs. We are open to helping hospitals. We'll continue to make donations across the country. Whichever hospitals that need our support would have medical educations to doctors, to stakeholders. I think in our as a company, probably that's how we can help the society.
Okay, so as GVS, if you pack your bags and luggages and you're going for the donations, what would I find in the bag? What are you going to give out?
So normally we give our anti-malarials.
What's it? I mean, I'll send you an invoice though.
You have Lonat. I think Lonat is widely known.
The popular.
So we are the manufacturers of Lonat.
Okay.
Yes.
Okay.
We have P-Alaxin. So we have tablets. We have suppositories. We have injections. Normal injections are used for severe malaria.
Okay.
So we also give out injections as well. So we try to combat severe malaria, complicated malaria, and all that. So.
Okay. Let me save Dr. the headache of vaccine, though we'll come back to it. But because he mentioned severe malaria, I hear there are types of malaria. Is this true?
Yes, there are quite a few types. So there's one type which most of us actually probably don't know too much of, and that is asymptomatic. So with COVID, we heard so much about asymptomatic. You have the virus, you don't have symptoms. With malaria, most of us adults are asymptomatic. We have the parasites, but we actually don't have symptoms of the disease. Then you have those who have uncomplicated malaria. That's those of us who have the slight symptoms, the headache, the vomiting, the colds. Then we have people who have very severe disease, and those usually have either respiratory distress or some even end up in a coma. And those usually who have severe malaria are the children under 5. And that's why we try to make sure that they have all the preventative measures and we have our eyes out on them. Children under 5 are usually those who have severe cases of malaria, and then the general public or population usually have uncomplicated, so they have just some mild symptoms. Okay. And then the majority of us, I'm sure if I test you right now, I realize that you'll be positive.
Apart from drawing my blood, how else can you test for malaria?
So that's the thing.
Like my mom would do, you put her hand on my head.
Oh, yeah. That's no. Well, so we do have, signs, the obvious signs and symptoms, but we've realized that there are too many other diseases that have very similar signs and symptoms. So we really need to actually see some parasites in you before we actually say that you do have malaria.
Okay, so for a doctor to actually administer what type of medicine I can get from GVS, they would have to identify the type of. I'm going to go on Zoom, but I'll come back to you again because of research. Whether there's any type of strain, are we discovering new strains and all of that?
Because of COVID, we've learned
I've learned strains. Okay, so we're joined by Dr. Nana Yao-Pepra, medical epidemiologist via Zoom. Hi, good morning, Doc.
Good morning.
Thank you for joining us.
Good morning to you.
Good. I can find you behind me here. Thank you for joining us this morning. Doc, so clearly today is 25th and it's Global Malaria Day. I'd like to find out exactly what you've been up to. I hear you're stuck somewhere in the Volta region. What have you been up to there?
Yes, so as Dr. Amwa said, on 25th April every year, we commemorate World Malaria Day. We use the opportunity to discuss the progress we have made in the fight against malaria. We also talk about some challenges and then we look at the way forward. So this year we are actually in Hohoi because Hohoi is one of the selected districts targeted for pre-elimination. Okay. And so we really wanted the opportunity to drum home the fact that we are moving away from just being in control to moving towards elimination. The first step away from control will be pre-elimination. So people should start thinking about moving away from the normal life of staying with malaria towards pre-elimination. So basically what we are doing this year.
Oh no. I must admit that from here to Hoho is quite
what
far.
we need
Okay.
as a country. Yeah.
Okay.
To get to elimination.
Okay, Doc. So very typical of me as a student, I'm thinking elimination and then there's pre. What does that mean? Oh dear. Okay, so we'll try and reconnect with Dr.
Sorry, I missed you.
Okay, so I was just thinking, Doc is saying pre-elimination. Elimination is a big word on its own before there's a pre again. What does that mean? Oh, God. Oh, I'm so sorry. The network is just, giving up on me. It's jumping ship on me, but I'll try and still see. But you can help me. What does that mean?
Okay, so pre-elimination, I guess, is the step. It's the phase in between control and then elimination. So where elimination means zero malaria, like there's no malaria. Pre-elimination means we're getting to a point where we are so low in transmission that the next step is we would be at elimination. And elimination means no record of malaria at all. Pre-elimination would mean that you have probably just single-digit records of malaria. Okay. And that's a really good thing because malaria in Ghana is high. So if certain districts have gotten to the point where they are seeing close to no malaria cases or very, very low malaria cases, that's really, really good.
Okay. Do I have Doc back on the line? Hi, Doc. Okay, we're sorry. The network is bad. Sorry. So before, hi, Doc.
He's talking.
Yes, please.
I apologize for the network is doing. I wanted help on the pre-elimination, but Dr. Amwa has helped me. So this year, the theme says that harnessing innovation to reduce the malaria disease burden and save lives. Are we maybe for want of a better word, decentralizing this theme as well in Ghana, or we have a special one we're doing?
Yeah, so I think basically what WHO is trying to say is for us to end malaria, but for you to end malaria, you need to be a bit more innovative. On the part of malaria control, we try as much as possible together with our stakeholders to identify ways and means to be a bit more innovative. For instance, what we did in our current strategic plan is to stratify our disease burden and get our interventions more targeted. What that meant was that in some districts, we were doing some interventions we thought to be more efficient. In other districts, we were doing other interventions. So we try as much as possible to get the best out of the resources available to us at the program. If I don't know whether Dr. Amwa has mentioned that already, but over the years, the progress we have made this progress with just about half of the resources we need as a program.
Okay.
What this means is that if we get more resources, we are going to do more, and elimination really is feasible. So we try as much as possible to be innovative, to try and see what works well in which places, and if we have the needed resources, we are able to implement them and get the resources we need to the results we need to get as a country.
Okay, so you're speaking to me from Hohoi this morning. It's nearly 8 a.m. Tell me specifically the activity or the program outline today in Hohoi.
So early in the morning, we will do a donation. We want to appreciate some people, so we're going to do a donation early in the morning in the children's home. And then we will have our deba. We will have the opportunity to talk about the status of malaria in Ghana, and we are going to reach out to stakeholders to invest in the fight against malaria. We have always said that this is a very feasible opportunity to eliminate malaria. If we have a task as a generation to end malaria, we have to tell the story to the generation to come that in our time we did eliminate malaria. And so we in Hohoi today, when we have the deba, we take the opportunity to get all stakeholders on board. And we're also going to drum home the fact that whenever you have the interventions, you should use the interventions, because the number of people who have the mosquito net and you're not sleeping under the net, the number of people who, when feel unwell, they don't go to the hospitals. And when they go to the hospital and they are tested and are given medications, they don't complete their medication. So we're also going to use the opportunity of the day to drum home all these behavioral change issues we expect from the populace.
Okay, well, thank you so much. I was just going to wonder why specifically Hohoi? Did you cast a lot and then you picked it and then Hohoi wasn't it?
So as I mentioned, per our strategic plan, we are looking at pushing at least 6 districts into pre-elimination.
Okay.
And pre-elimination means that they should get to the point where at least if you suspect about 100 cases of malaria, only about 5 or less of them should be confirmed as malaria. And when we looked at our data, about 6 districts having just around less than 10% of prevalence. And Hohoi happened to be one of them. So Hohoi, Asokwa, Ayawaso West, Tema West, Shai Osudoku, and Ablekuma Central. They are the 6 districts that have been selected. And then we looked at where, I mean, maybe at that point you could talk about random selection. But
okay.
it's basically because Hohoi happens to be one of the districts with very low prevalence, and we are targeting them for pre-elimination. That's why we wanted to go there to commemorate this day.
I totally understand then. Thank you so much, Doug. I'll let you go. It's nearly 8 so you can prepare for the day. We'll get to talk to you a little later to find out how the day went and we'll update our viewers later. Thank you for joining us this morning. Have a good day. Okay, Doug, I haven't forgotten about the strain. And I'll come back to you. I'll come back to you as a company. We'll talk about innovation.
Okay.
I must know that for a pharmaceutical company, you must have invested a lot in even getting to the anti-malaria drugs and all of that. I mean, to know that that is a popular brand that Ghanaians have come to accept. I want to understand what's your role or what you think you can do in terms of innovation. Okay. But Doug, let's talk about the strains. Is it something to worry about? Does it also mutate? That's another word I learned.
Yes. Oh,
it does?
Yes, it does. So that's why we keep on saying that you have to complete your full course. Yeah. If you don't, then the parasite becomes resistant. When it becomes resistant, it develops certain mutations that enable it to survive, even in the presence of the drug. And that then makes the drug ineffective, and then people will take the drug and then they still have malaria and it gets worse. So with malaria, we also do have problems with mutations as a result of the parasite becoming resistant to the drug. And one main reason why that happens is because people don't complete the course, or people take a lower dose than is expected, and that becomes very problematic. So, you know, earlier on we were taking chloroquine. Chloroquine was what we were using for anti-malaria. It was 100% effective. Then we stopped taking it as we should, and then the parasite became resistant to chloroquine, such that if you take it, the malaria doesn't go away, you actually even get worse. So then we changed, and now we're using ACTs. Luckily, we don't have resistance to ACTs as is, but then if we keep on not taking the treatment as we're supposed to, the parasites will develop certain mutations that will make it resistant, and then ACTs will become inefficient or ineffective. And that's why the NMCP has a very strong program that is looking at drug efficacy, is looking at the generation of mutations in the parasite, just so that they would know as soon as the anti-malaria becomes ineffective and then change it to something else. But it's our hope that it doesn't happen that way, because for now we don't have anything beyond our ACTs.
Okay. I'll find out again. If I come to Noguchi right now, because of research, what are some of the things I'll find that Noguchi is doing in terms of research for us? But let me come to you as a... So if I'm not well, I mean, if I'm well, but I feel like I'm very paranoid towards malaria, can I go and take Lunat?
No.
Why not?
You would have to test whether you have malaria. So when she was talking, she talked about 2 things. She talked about the doses, and she also talked about the fact that taking the strengths, you under treating the malaria with the right strength. So as Bleach DVS Ghana, you're asking about innovations. Yeah. We've managed to make sure we have our drugs in various strengths for children, for adults, for pregnant women. So we have research in pregnancy, first trimester, second, third. I think one of our latest innovation has to do with one of our drugs, where the dosing is very what's the word? Should I say expedient or easy to take for the patients? Okay. So for that particular drug, you just take 1 tablet a day for 3 days. And it's approved
by speaking to me, 1 tablet a day. Oh, thank goodness. Yeah. Because we've always been, why do you have to take so much drugs just to cure malaria?
Yeah, so I think it's a process. It's a process. As time goes on, we do more research. If it works out, we send it to WHO, they approve. We start educating stakeholders, doctors, that they should prescribe these drugs, making them available in our pharmacies. So I'm sure we'll get there.
Okay,
we'll get there.
Let's stick to what you said. So if I went to the pharmacy this morning and I'm not, you can't see, the pharmacist cannot see that I am pregnant. And I say, I feel like I think I have malaria. And the pharmacist insists, let's test before. Yes, they test and I have malaria. Do they have to test for pregnancy test? Do they have to do pregnancy tests as well? So, because I may not know that I'm pregnant. Doc, you agree that? you agree that I may not know, right?
Yeah, I think the pharmacy the pharmacist will ask you
if you are pregnant.
Whether you are pregnant, because there are almost every drug, there are contraindications. There are drugs you don't take in first trimester. There are also drugs you don't take in third trimester. So pharmacists are trained to dispense drugs. So I'm sure the pharmacist will ask you whether you are pregnant or not. If you are not sure, probably the person will just take a short history for him or her to be sure whether you are pregnant or not.
I asked this because you said that there's so much innovation that's gone into the production of the drugs, the one for the kids, even if you're pregnant. So if a pregnant woman, they don't take normal malaria medicine?
No, they do, but it depends on the trimester.
So if trimester is 3 months, if like 6 months now, and my stomach is like pain, if I come, my medicine will be different.
Not different.
Not different.
It will be the same drug, but if
the administering of it or what?
So let's say if you are in the first trimester, that particular drug, you can't use that particular drug even in the first trimester. So they'll have to know whether you're in the second or third. She talked about SP.
What is that?
Sulfadoxine pyrimethamine. It's yes. It's not ACTs that you know, but that's what we give to pregnant women as a preventative measure. So that is taken whether they have malaria or not. They actually are given those doses when they go for their antenatal care, and they take it at certain time points. And this helps prevent them from actually getting malaria. And that's because of
We'll take a trip to Noguchi again, but I want to understand what anti-malaria is, because my understanding of some anti means that I do not want to get it. So anti-malaria
is treatment against malaria.
Treatment against malaria. So if you have malaria,
the malaria parasites.
To cure it too is under anti.
Oh yes. Okay, so you have prophylaxis and you have chemophylaxis, but yes, they are all. It's all treatment, and all treatment that kills the malaria parasites or that are targeted against the malaria parasites are anti-malaria.
I ask this because sometimes you have a friend or a relative who is coming to Ghana and would say that, oh my God, I'm afraid that I'll get malaria, so I'm taking some medicine or I'm taking a shot so that I don't get malaria. And in my mind, that is anti-malaria because I do not want to get malaria. But if I'm ill, they say they're giving me anti-malaria. So that I just want to know the thing that they take. What is that?
Oh, so there are a few different things. Some people take Malarone. It really depends on where you're coming from. But these drugs are taken at a different schedule. So they're not given as the ACT cause. They probably take it either once a week or every other day, and it depends on what drug. There are quite a number of different drugs that are used to prevent the establishment of the infection. And there are some drugs that are used to treat once you have the infection.
Not to cut hair, but we even have one drug that is for treating malaria and still provides prophylaxis up to about 63 days.
You sound prophylaxis. I know what prophylaxis is.
Prophylaxis basically has to do with preventing reinfection.
Okay.
So sort of extending the time for reinfection to occur.
Okay, talking about reinfection, is it possible that if I got treated for malaria today and I feel fine, is it possible that 3 days later, no, I can still get malaria? Considering I find myself in the environment that caused the malaria, is it possible I can get malaria again?
So interestingly, when a mosquito bites you, it takes probably 7 to 10 days for you to actually have signs and symptoms of the disease. So if it happens that you didn't take your medicines well, then it could be that after day 2, you had low parasites that just expanded in population, and so you end up getting sick. So that's why we say you should take your treatment as scheduled, and that will prevent that. We do have instances where people do end up feeling feverish again, and in certain instances we say there is delayed clearance of the parasites. So the parasites didn't clear after the first or second day. They survived a little bit in the presence of the drug, and we say they are probably have gained some tolerance. So they're not resistant, but they have gained some tolerance. But usually it doesn't happen if you take your medicines well.
Oh, okay. Let's take a trip to Noguchi.
All right,
I want to go on a session.
Oh, Noguchi. The malaria team at Noguchi is big. We have different sets of principal investigators. So what I do at Noguchi is I look into diagnostics and I look into transmission. And that means that I am helping people to develop new tools that can be used to detect the malaria parasite. You actually asked whether, apart from pricking, what else can we use? So I'm working with a group where we're using saliva. We're using saliva as our source sample to see whether we can detect malaria as effectively as using blood, meaning that you don't have to be pricked. So we're working on that, and we're working with other companies to develop test kits that are very sensitive and can actually detect when you have very, 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 very low levels of parasites, which the regular kits or test kits can't detect. Then we have a big vaccine group. With the malaria parasite, we have malaria that infects the liver. Then we have those that go into the bloodstream. And even in the bloodstream, there are different forms. So we have a group that is looking into...
Wait a minute. So is it the same malaria that got into your body and decided to go into the liver?
Yes, it actually begins its life in the liver. Then it moves into the bloodstream. Okay. So we say there's the hepatic form, so they stay in the hepatocytes. Then they go into the bloodstream. In the bloodstream, we have one form that causes the disease. Those are the asexual parasites. Then you have another form, which are the sexual parasites that are actually picked up by the mosquito and then transmitted to another person. So we have different groups of people that are looking at each of the different stages to identify good vaccine candidates to help in preventing the development of the different stages.
Oh, I see why vaccine production takes a while.
It takes a long while. We have a group that are looking into pregnancy-associated malaria. There's a particular specific type of malaria parasite that infects the pregnant woman, and so people are looking into developing a vaccine for that. We have a group that is just looking at the development of resistance in the parasite. So they're working with the malaria control program to sample from all the region and see are there any signs of parasites that have developed resistance or not. We have groups that work with vectors, a very big group. They look at the adult mosquito, they look at the larvae, so that if the larvae are cleared, then we don't have adult mosquitoes in. The adult mosquitoes, some have become resistant to a lot of insecticides. So,
true.
Yes.
You spray them,
they fall down, and then they get up again.
They dance calypso,
and then they come back.
The insecticide goes, and then they keep flying back again. Wow.
So we have a big group that is looking at new insecticides and new treatment for the vectors. And also the nets that come, they have different chemicals that are treated on them. They look to make sure that the particular ones that we have are effective against the mosquitoes that we have. So there's a whole lot of malaria research going on in the institute.
That's quite impressive. I mean, my time is already up, but I know. I know. But Jeannie, I'll let you take, in wrapping up, I mean, we've seen the work that you have done. We're showing it on the screen, your travels and then the donations. But I'll let you take again. have in any way the causes of malaria changed, or they still remain the same?
The causes of
the
malaria.
Cause of, I mean, yeah. Has it changed? Is it still the female Anopheles mosquito?
Oh, yes.
Yes.
It is the same
yes.
one.
Yes, yes.
Okay, and is it still the fact that you have to empty the drains and take care of your area and all of that?
Yes. So the mosquito lays its eggs in stagnant water. So if you have any stagnant, any container, a sardine can, a tomato tin, that rain falls in and then there's a little bit of stagnant water, the mosquito lays its eggs and then boom, you have a whole adult mosquito population coming in. So yes, we are trying to make sure that our environments are dry, not just clean, but then dry, so that the mosquito doesn't lay its eggs and then you have a boom. And then, yes, we use nets. Our houses should have mosquito nets as shields, and we should sleep in nets. It's pretty hot, but then it's better to sweat a bit than to actually get malaria. So,
okay.
Yes.
Did you hear? It's better to sweat a bit than
to have malaria, but it's very true.
Yeah.
When you're sick, you're sick.
Yeah.
So, yes, we can all help to end malaria by making sure that we at least stick to our treatments, we prevent ourselves from getting infected, and we keep our environments dry.
I think Dr. Amwa is quite a nice person. I'll let you have the last. What's your last message from GVS Ghana? Yeah.
Okay, so as GVS Ghana would continue to support institutions who are in the fight against malaria, like
I've made a new partner.
Yeah.
Oh, glad.
Yeah, we've been talking before we came on air.
Okay.
So I think that's it's part of our social responsibilities to donate to hospitals, partner with NGOs, companies, under the Act for Africa campaign. So it's not a one-time thing that we are doing.
Okay.
Yeah.
Please go to the Volta region, particularly at the Dome Hospital. That's where I come from. Pass by Sugako Hospital as well. We do some donations over there. Thank you so much. We've been talking to Dr. Linda Eva Amwa, Senior Research Fellow. You'd find her at the Immunology Department at Noguchi Memorial Institute. And also thank you to Jeannie Wadi Boating. He's a rep from Bliss GVS Ghana. They've been doing some work supporting the cause for malaria. A gentle reminder that today is 25th of April and it is Global or World Malaria Day. Speak about malaria to somebody. Let's save lives. Thank you for joining us on Beyond the Headlines. Guess what? The big interview comes up this day.